Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Hey everybody, welcome to episode 2, which is another telehealth-centric or telehealth-focused episode. This week, however, we're going to be talking about something a little bit more interesting and a little bit more out of the norm of the typical traditional, quote, biomedical frame of reference. So this isn't like a shoulder clinic that moved into telehealth or that moved virtually. This practice is a pretty interesting concept. My guest is Sheila Ivlev. She's an occupational therapist out of San Francisco, the great state of California. But her practice focuses primarily on wellness and on a specific type of wellness, being mental health and emotional well-being or emotional wellness. So she talks a little bit about some of her practices, some of the techniques she used and uses in her day-to-day. And we also dive into some of the ins and outs of telehealth, particularly in this type of setting or practice area where we're dealing with different types of consent, particularly with groups and group treatments. And obviously, if you got 3 or 4 people on a Zoom call or on some kind of telehealth platform, there's just more risks to personal information being exposed. We talked about that a little bit. We'll talk a little bit about her practice in general and kind of her focus in her practice on creating strategies and habits to deal with stress and anxiety. She calls emotional resiliency, boosting some self-esteem and confidence. And we talked a little bit about, I threw a couple questions at her. So let's say somebody's got this issue going on at work and they're dealing with stress. How might you deal with it? So she gives a little bit of insight on that as well. Hopefully you find this a valuable and informative episode. Again, our goal is that you walk away from these episodes or these little snippets here, these interviews, with some kind of practical advice. So even if it's what platform to use or how you would use it and thinking about consent or changing the way you would think about delivering your healthcare services, that's our goal. So without further ado, I'm going to take you right into the episode. So here is Sheila Ivlev from OT Bay Area Mental Health and Wellness Practice. Hey, Sheila. Welcome to the show. How are you doing?
Hi, I'm doing well. How are you?
I'm doing wonderful. Why don't you start off by just telling us a little bit about yourself? You're an OT, so tell us kind of how you got into OT and then where you're at now professionally, and we'll dive into the topic at hand, which is telehealth.
Yeah, sounds good. So I'm an occupational therapist, and I actually had a few careers before I became an OT. I worked in mental health as a counselor, and then I realized that didn't pay the bills. So I had a corporate career for a while, and it just wasn't meaningful for me. So I knew that I had to do something that felt good, that made me feel good about going into work every day. And I realized that I probably needed to go back to school for that. So I looked into OT and PT, and I actually did my volunteer hours simultaneously so I could get experience in both fields and see which one seemed like a better fit. And OT just it was perfect for me. Super holistic, looked at every aspect of the person. So became an OT. I've worked for major Bay Area hospitals. I worked in BizDiz, but I've been working in mental health throughout my career. And like I said, I worked for major hospitals. I also worked for the VA, which I know that you're familiar with.
Oh, yeah. I'm familiar with the
VA. The thing that I really loved about the VA, though, is that you're really not held down by the traditional healthcare model, the insurance reimbursement model. So I felt pretty empowered as an OT to do what I felt was necessary for my clients.
Yeah, I thought that same thing when I was there. I could see clients for as much or as little as we needed you to get get the results we needed for them. It was great.
100%. Yeah. I mean, I got to go into people's homes. I got to retrofit homes, like, really no caps in equipment as long as it was appropriate, medically necessary. So all of those things were great. I also have been a clinical educator, so taught clinical mental health class. So there was actually a clinic on campus with people from the community working with graduate occupational therapy students, completely free clinic, standalone OT, which is
cool deal. Yeah.
not very common. Yeah. So, just between all my experience and especially being able to have the standalone OT program that's free and focused on mental health, I knew that I wanted to do more with all the experience that I had. And I wanted to do something that was like beyond the control and limits of insurance. So that's when I decided to start my own practice.
Yeah. And that's basically, from what I can tell, you're doing mental health, you're doing wellness, you're kind of doing the whole gamut for your clients, right?
Yeah, exactly. So, I don't need somebody to come to me because they have a referral from a doctor. I don't need a diagnosis. Anyone that is looking to improve their physical and emotional health, I'm working with.
Yeah, that's awesome. And we'll put the link to your practice and all that in the show notes so people can find you.
Okay.
But let's move on to telehealth. So how did you get started in telehealth? You did it at the VA, right? That's when they were rolling out an initiative there.
Yeah, so the VA actually has been doing telehealth for quite a while. And the type of telehealth that I did was from one VA facility to another VA facility. So I worked at the San Francisco VA, which covers a huge Northern California region. So there are a lot of veterans that live in super remote areas that would have to travel 4 or more hours to the San Francisco VA just in one direction to be seen.
Yeah.
So there are several clinics throughout the VA system. So it's not a full hospital, but like an outpatient clinic.
C-Box,
and so,
is that what they're calling them?
C-Box, exactly. Yeah. So several of those actually have telehealth technicians that are working at that facility. So I was able to be the clinician and have a telehealth technician on the other side. So I did mobility assessments. I fit and trained people on, manual and power mobility devices. So I got to do a lot remotely because I had somebody there that was hands-on. So definitely different than what I'm doing right now.
Yeah, that's a different model. And it's nice that the VA kind of has this, they've got this huge nationwide system. And we had the same thing at the Augusta VA where we had the Athens CBOC and we could telehealth in, and it's nice to have a technician that could make the adjustment here, do that there, and that sort of
thing. Exactly. And, I know that for a while now that the VA has been trying to get people secure devices in their homes as well, but that's not the model that I used.
Yeah. Okay. So tell me a little bit then about the kind of conditions did you treat? Was it all like physical dysfunction, or was there a mental health aspect to it? How did it work?
Not for telehealth. So what I did at the VA for telehealth was all for physical conditions. So, anything from neurological conditions, progressive conditions. So obviously ALS, MS, any neurological conditions in which people weren't improving and needed some help with mobility. They needed some kind of device to be able to access their home, access their communities.
Yeah. So it was basically almost an equipment, like a wheelchair clinic or something like that.
Yeah, exactly. So
positioning and that sort of thing.
Exactly. So mobility clinic, so seating, positioning devices, exactly. And I did a lot of home retrofitting, but that's something that I had to be there in person for. So with the telehealth, it really was just seeing how somebody moves, taking measurements, training them how to use the devices while I was able to watch them and somebody was their hands on complying with my instructions.
Yeah. Was it the patient by themselves a lot of times, or did they have family members or caregivers present?
A lot of patients had family members and caregivers present. Again, if you think about people who have limited mobility or mobility issues, they may not be able to drive a vehicle by themselves. So they're still having to get to that clinic.
Yeah.
So the nice part was that, family training was being done along with the patient.
Yeah. Okay. As far as that method of service delivery, are you still doing telehealth today in your practice?
I'm doing telehealth in my personal practice, but it is purely wellness, mental health, not mobility.
So you're
I'm
thinking
doing
that,
some ergonomics.
yeah.
That's a little
So a lot of that
different.
is, I love when I talk about telehealth with folks, I always talk about the opportunity that telehealth has, at least the way I see it, is it allows us to still do those like high value, high impact treatments. So the coaching, the empowerment,
Right.
self-management skills. And it sounds like what you're doing currently is kind of in that area, right? You're helping people develop healthy
Yes.
lifestyle patterns and that sort of thing.
Yes, exactly. I call it resilience skills. So
Oh, I like
really
that.
skills to help you be able to deal with everything that's going on in your life, whether it's emotional, current events, even physical pain.
Yeah. So are you teaching mindfulness techniques and that kind of thing over the interwebs?
Mindfulness is a part of it, but really, so I do individual and I do groups,
Okay.
and my groups are very small. So everyone that's in a group has already had a one-on-one assessment, again, over telehealth. So people are grouped based on what their goals are, what's important to them, what they want to work on. So if it's mindfulness, it's really practical mindfulness. How are you able to incorporate it into everyday life?
Okay, cool deal. Oh, I want to dive into that whole idea of small, like goal-driven groups in a minute. But so you've been on both sides on doing very much like a physical dysfunction model of telehealth, and then kind of this new like holistic telehealth that's out there, the coaching, the empowerment,
Yeah.
wellness. From your perspective, having been in both and having also practiced in the like in a real world in clinic, what are the positives, if any? I mean, you're doing them, so you see positives. What are the positives of this type of service delivery, basically telehealth?
Yeah. So, pre-pandemic, it really was about getting access to individuals who didn't have access, right? So, for various reasons, people aren't able to access care. Either they live in remote areas or they don't have transportation. Sometimes they don't even have the funds to make that travel to their nearest clinic, their nearest hospital to get services. So in my mind, the number one problem that telehealth is solving is access. Obviously, there are caveats, right? You have to have the technology, you have to have internet service, you need to have a device to utilize it, but you are really closing a lot of barriers for a lot of people.
Yeah, so you're basically letting somebody that couldn't get there, or at least do it in their home, right?
Right,
Yeah.
exactly. And then
How
I will
about
say,
the actual treatments you're delivering, the services you're providing? Are there benefits or are there instances where you might choose telehealth over in-person treatment?
well, obviously, for hands on physical types of treatment and modalities, you want to see the person, you want to touch the person, you want to see their environment. Ideally, you're doing this in their home if that's possible. Telehealth isn't the ideal model for it, but specifically for wellness, I think, again, you're breaking down even more barriers. So people may not have time to access this kind of care. And so you're really making it convenient for them. And so I found with both individual and group sessions in wellness that I'm able to get care to my clients when they need it. And that's something, especially in a pandemic, that is, impossible to do in person. Now we're, at least in California, we're rolling out measures where we can start providing care in person and gathering, et cetera. But, for over 2 months, people have felt socially isolated and they're getting trouble just finding somebody who's available, like figuring out who should I talk to, who can help me, where are they even taking new clients, all these things.
Yeah. Do they even have
Are significant.
capacity? Yeah.
Do they have capacity? And then, not everybody's set up for telehealth, right? Like, yeah, we can see you, but once we open up. So for wellness, I think it's been really convenient for people to be able to access their phone, their laptops, their tablets, and learn new skills, get support, and especially the community component. I haven't done in-person groups at all in my practice in wellness because it's been an individual model. And with telehealth, I wasn't expecting to do groups. And the groups were just so successful that I realized that, there's an affordability factor. So it's easier for people to do more groups because it costs less than an individual session. I'm doing a lot of free groups as well. And that's easier for me to utilize my time to touch more people. They really just have to set out a time. There's no travel. They just make that one-time commitment of an hour or whatever it is that's scheduled to tune in, and they're getting a sense of community, learning a new skill, and taking time for themselves, which again, pre-pandemic, they might not have had the time to do, because with travel, that becomes like a 2-hour
exactly.
thing versus
you get in your
just
car,
60 minutes.
30 minutes there, 30 minutes back, however long the appointment is.
Exactly.
Yeah. Now, you mentioned something about cost. In California, are there barriers or issues around reimbursement, or a lot of the work that you're doing is covered private pay or covered by insurance? How's that working for you?
So, I'm a cash-based business. So, I try to provide my clients with the super bills so that they can get reimbursements. I'm recently started accepting the HSA, FSA funds to make it easier for people. So, I can't really speak to how problematic it's been for certain individuals. I personally just make it easier if people are worried about insurance reimbursement and they can't afford sessions, then again, that's where I utilize groups with people with similar goals. And I have like pretty low sliding scale fees because it's easier again for me to see more people, and I don't want to turn anybody down that's having financial hardships.
Yeah, no, that's a great point. I was talking with somebody, a colleague at the university the other day, and I said something like, I feel like cash practice or private pay, where you're removing that third party payer, is really the way healthcare should be, because
Right.
the decisions and the incentives are all aligned. But that colleague of mine said, well, you really have to worry about people that just can't afford,
Right.
wouldn't be able to
Exactly.
afford services without some kind of insurance coverage. So the idea of being able to not turn away people or have some sort of really low sliding scale or offer groups really helps kind of advance that issue that, there are people that legitimately can't get care. They just
Exactly.
can't afford it. And whether or not their insurance pays for it, they probably couldn't pay the copay or whatever. So I like hearing that
Exactly.
there's some sort of there's some option for them, right?
Right. And it really, it really does depend on the insurance as well. Like, state to state, yes, I know that there are different hurdles, but just the insurances themselves, they're just so different. And, their reasoning for why they'll accept one claim and deny another can be pretty overwhelming and confusing. So for me, I have the luxury in my practice to say, you know what, I'm going to make it easier for you and you're going to get care no matter what.
Yeah. So tell me about these groups then that you're running. How do you structure them? What does a telehealth group for, I don't know, what's your most popular one? What does that program look like, and what can patients experience or clients experience when they go there?
Yeah. So, again, this is something that's relatively new for me since shelter in place, because I was not expecting to do groups in this format. But I'm starting with 4-week sessions. So we meet once a week at the same time every week for 4 weeks. As I mentioned before, everybody gets, initial one-on-one assessment, including like a personalized self-care plan. And based on their goals, they're matched with other individuals, and we're meeting at the same time for 4 weeks. So each week there's a new topic, a new theme, new skills that you're learning. And typically you have, again, another plan that you're taking away from it. So it really varies, again, on the individuals and what they want to work on. But at the end of the 4 weeks before that last session, I do another one-on-one with each individual and see if they'd like to continue working for another 4 weeks, or if they wanted to, just kind of take some time and work on the new skills that they've learned. So, we, again, depending on what is important to the individuals, usually the first group is super basic and really diving into self-care, why it's important to take care of yourself. And we start with breathing. I think breathing is one of the most important and free and easy tools that we have access to anywhere and everywhere we are. So we practice controlled breathing. And I teach a few simple strategies that are easy to remember, easy to do. And then you end up with a homework assignment. So for the next week, you're practicing these different breathing strategies and, measuring how you felt before doing it and after doing it.
Yeah, no, that sounds awesome. So it seems like the majority of the people then that are coming into these programs, or at least reaching out to you in your program, are not they're not in crisis mode, right? So
No, so
it's very much like a proactive strategy.
yes, and I appreciate you bringing that up. So, if somebody is in crisis as an individual practitioner, as an occupational therapist, I may not be the right fit for that person. So I definitely work with individuals who have their own psychotherapists, who are also working with psychiatrists and, other medical specialists. But crisis, especially group format, it's not the right fit.
Yeah.
If somebody's in crisis, I, again, having worked in inpatient psych and outpatient psych, I have all those resources. So, if somebody comes to me and they need a higher level of care that I'm not able to provide, then I'm able to at least give them the resources so they know the next steps to take.
Yeah. Yeah. All right. So we've talked about kind of this idea of proactive care. Can you talk a little bit more just about the role of wellness, the OT's role in it, how you've talked about some of the strategies you help your clients with, but how does it work? Like say I'm feeling a little stressed about work. Let's say maybe I'm having problems with anxiety or stress related to work related pressure or something like that. What might be a first step? Is it coming to see somebody like you, or is it trying to do something on my own? How does it work?
Okay, so let me clarify the question. So somebody is seeking support and they're having specific issues. What are their first steps?
Yes.
Yeah. So, let's be real. You're an occupational therapist as well. So most people don't even realize that an occupational therapist can help them with certain issues. Sometimes even the physical issues, they're not even aware of what OT does.
Exactly.
Right. So I will say that that's definitely a problem, helping people understand that distinction between what is occupational therapy. And I believe you asked this question just before, so I think it kind of fits into this answer of why I think OT is so important in this wellness space, is that we address both physical and emotional health issues, right? So, we're covering a lot of ground that other providers may not be able to access because they're limited by their scope of practice. That being said, there's also just like that barrier of awareness of services available to people. I don't think that there are too many people out there that realize what OT can really do for them. Part of my work is really I'm trying to get it out there. I'm using things like social media, probably not very successfully, social media to educate people, but I'm reaching out to local community groups, right? So especially with mental health, NAMI is one, and I've worked with them in my free clinic as well when I was teaching, to really just get clients over to me. So I'm reaching out to local organizations that provide care and are focused on wellness. I'm reaching out to local companies and businesses, and especially with the start of the pandemic in this country and with the tight restrictions that we have in our area, I started just providing free groups. I knew that people needed support. So I'm like, okay, what can I do? Started using Zoom to just provide free groups for different types of relaxation strategies, and reaching out to communities, like no strings attached, just, hey, I think everybody needs some community, everybody needs some support, and everybody would benefit from learning a new coping skill.
Yeah, so you kind of just provided the value out there, let it speak for itself, right? People
exactly.
Are like, oh, this is something I could do after this, right?
Exactly.
Yeah, how do you see telehealth in regards to your practice and wellness and holistic therapy, kind of this proactive health approach? How do you see telehealth playing a role in that after this pandemic? Because at some point, hopefully, the doors will open and we'll be back to shaking hands with each other. Do you see a role for telehealth in a practice like yours going forward?
I definitely do. Again, pre-pandemic, didn't even think about utilizing telehealth. Again, I love like that face-to-face contact. I feel like, okay, I need to see you in your environment, even if we're just focused on emotional wellness, because it tells me so much. But it's really working well. I'm getting positive feedback from clients. I'm really realizing that it is filling this gap for people that are busy, may have transportation issues, or whatever the reason is that they're not seeking this type of care. So I plan to use telehealth indefinitely, even, as the restrictions start to roll back and, we start providing face-to-face care.
Yeah, and like I think I mentioned earlier, I think the ability to offer those high impact, high value treatments and services over telehealth hopefully will allow it to be one of those things that gets reimbursed later and that we're able to
Right.
continue into the future. Because it does, like you said, it increases access, decreases costs. There's just a lot of benefits to it.
Mm-hmm.
What are some of the drawbacks that you've noticed practicing telehealth?
Yeah. Well, I mean, the technology is the limiting factor, right? Like
Uh-huh.
technology is bringing us this resource, but it's also the limiting factor. So, you have to have certain equipment. You need a smartphone or a tablet or a computer that has video access. You need high-speed internet in order to actually hear me in real time and be able to see my face and for me to be able to see your face.
Yeah.
So for individuals that just aren't tech savvy or don't have the support to set it up for them, or again, they don't have these actual resources to access, this equipment and internet, basically, they're not going to be able to partake in it. It's just not going to work.
Yeah, and then I was actually reading an article the other day, a research article in, like, I think it's published by HP, but it was about latency in telecommunications and what that does to patient perceptions of healthcare services,
Of
or just people's
course.
perception in general. And it's funny because you talk about seeing somebody in real time, hearing somebody in real time, and we take that for granted in the clinic. But when you take that and put that on the internet and you're talking with somebody who's already having, maybe they're a little unsure about the technology, they're
Mhm.
trying to figure out how it works, and then on top of it you're skipping or you're freezing or whatever, I can see that being very frustrating to to say the least. um,
Right.
from a treatment modality, from a treatment perspective, what are the main drawbacks? Obviously you can't touch
Yeah.
people, but are there any big things that you got in when you got into telehealth? You're like, oh wow, I didn't account for this, or this was something that's
Yeah.
kind of something we need to plan for.
So part of this answer and what you just said is active listening is huge in what we do, period, as OTs, but especially in, mental health care and wellness. It's very important. And so again, if there's that latency, then there's some disconnect. So it's harder to really build that trust with your client if they're not feeling heard, literally.
Yeah.
And eye contact is huge. So again, when I'm doing groups, I need these groups to be small because I want to make sure that I'm seeing the client and the client is seeing me. And there's so much that we get from nonverbal body language, right? So I'm able to assess really somebody's attention. Are they checking out? Are they understanding what I'm talking about? Is it really hitting them? So, being able to assess someone's response to treatment is really, really important. And there can be a barrier with telehealth, again, with the latency, or if you have this like big group, or if the lighting's off or the picture's off, by a little bit, then you're missing so many components that you would be able to gauge if you were in person with your client.
Yeah, no, that's a great point. Do you run your clients through kind of like a tips sheet before they get started? Like, position yourself here, make sure that there's no bright light behind you. Are there practical tips that you give to folks?
I don't know if this is the most effective way, but I like short videos. I don't create the videos, but I scour YouTube for like troubleshooting and tips because someone else already did the work and did a good job of explaining it. So I'll send over videos. Again, that requires you to be tech savvy, right, to
Uh-huh.
be able to access and open it up. But I find strategies like that are better. With telehealth, there's even more documentation for the client. There's even more things for them to sign. I feel like I have a little bit more paperwork that I'm sending them after our group that reviews what we did, gives them things that they can continue to work on, which that might be something that we're going through in person if it was an in-person session. So I find like the videos are just a different method of delivery. So there's just not more to read, more to review, and
more paperwork and all that. Yeah.
More paperwork, exactly. So short tutorial videos is usually what I send over.
Oh, no, that's a great strategy. How about, you kind of mentioned about there's more documentation for patients.
Yeah.
Describe some of that. I'm sure there's some kind of consent involved, and there's some kind of right to video, right?
Yeah. So, I probably have a little too much redundancy in my documentation, but, I have, obviously, we've got the HIPAA and privacy policies that we need to provide our patients with. But I'm doing both individual and group telehealth, and my group telehealth also has individual telehealth components. And the language is different because in groups, there are other individuals that are participating, and you have to maintain their privacy as well. So, if you're doing groups, you have 2 sets of telehealth forms that you need to read and sign. And then I also have, because when I'm doing my intake, I'm like, you might as well look through everything and sign everything, because things will change and I might be able to work with you in person. So I also have the consent form that allows, it's different. Telehealth is different than in person, right? And so I'm getting new clients that I haven't actually been able to see and assess in person. So I have the forms for being able to treat them in person as well. So it's, it kind of piles up. No one's complained yet.
Yeah. No, we were, part of the work that I do with the Department of Behavioral Health here is we've basically set something up, a system for telehealth for them. And their big thing was about how do we get consent for telehealth. And like, you even have to worry about people being in the room, right? That might not
exactly.
have access, or you don't want to necessarily have access to the person's personal information and all that.
Exactly. So, that onus is on me, but I also have to make sure that my clients are respecting those rules as well. So they're in a private space where no one could overhear the conversation or see what's going on.
Oh, especially in groups, I'm sure. Yeah.
Especially in groups. Exactly.
Because there are other people talking.
Mm-hmm.
All righty. Well, any last minute practical tips or advice that you would give to clinicians that might be wanting to start a telehealth practice or start into this realm of virtual service delivery?
I would say definitely take the time to educate yourself on all the different technology that's available. You're probably going to have to invest in a few things. You want a camera that actually will show your face properly. You might need to purchase lighting, microphone or headset for sound. Again, you want to reduce any of the barriers to care, especially using the technology. Some people might need even to upgrade their internet service. And there's so many platform choices out there. So, take some time, play around. I definitely did mock sessions, mock groups. I have a really supportive base of family and friends that actually, to this day, I'm still doing my practice groups with them because they want to keep doing it. They're not my clients. They're just my friends.
They're reaping the rewards, is what they're doing.
Yeah, they don't want it to end. So so I've been doing that for quite a while. You really want to test things out when you're doing it over telehealth, because you have to really understand, what is my client seeing? What is my client hearing? Are they going to be able to understand? So my test groups were really just, I'm going to do this whole group in front of you, and I want to get feedback. How can I make this better? What were some problems that came up? So you have to practice. You can't just jump right in without taking the time to test everything out and make, you have to see what it's like on the other end for your client in order for it to be successful.
Yeah, no, that's a great tip, practicing ahead of time.
Mm-hmm.
Are there any resources that you would send a clinician to that might be interested in telehealth? Any websites?
Yeah, I can probably just email it to you. There is an occupational therapist who actually compiled a list. Often with telehealth, I think of online, oh my gosh, I'm drawing
Service
a blank.
delivery?
EHR systems.
Yeah.
So, there are different platforms for writing your notes, for taking payments, even insurance billing. And some of those actually have telehealth attached to them.
It's integrated.
Yeah. So there's many ways to do it, right? It's really up to how complicated you want it to be and how much you're willing to spend. There are lists all over. I mean, I've looked up lists, I've read articles, I combed through all the different professional Facebook groups I'm in. I posted questions, I tried out all the different platforms. There is one OT who wrote an article who has a pretty comprehensive list. I can send that over to you. I'll find it and I'll send it over to you if you want to maybe link that.
Oh yeah,
and
cool.
I'm happy to share my experience with anybody. And there, technology is forever growing, right? Forever changing. So if you're listening to this a month from now, there might be a new platform available.
Exactly. Yeah. Something else sprung up.
Right. Or there might be an issue with a platform that we weren't even aware of. So, I would ask questions. If you're on a Facebook group, just put the question out there. People have been super supportive in giving their experiences. And, again, you have to test it out because it depends on your population. I got, people referred me to certain platforms and they were mostly for pediatrics and they really just didn't work for my client base. So there's no one place. You're going to have to do a little bit of research and you're going to have to test it out. But again, I'll send you the one link that I found really useful.
Yeah, cool deal. Well, where can people find you on the interwebs, on social media, all of that good stuff?
Yeah, so my website is otbayarea.com. And that's for clients, but if you want to reach me as a therapist, I am happy. I've been doing it for a long time. I still mentor my old students, and I'm happy to take the time to talk to any new or seasoned OTs that are interested in doing what I'm doing. It's you got to pay it back. Somebody helped you along the way. So
exactly, yeah.
My contact information is on there if you want to reach out to me. All of my social media links are on there as well. I'm on Instagram, Facebook, LinkedIn. So
all the places, right?
all the places. Yeah. So, my name is Sheila Ivlev. You can look me up, but probably my website's the easiest place to start and everything's linked on there.
Okay, great. Well, we'll put all that information in the show notes too. Sheila, thanks for taking the time.
Yeah, thank you.
Well, I hope you enjoyed that interview with Sheila from OT Bay Area Mental Health and Emotional Wellness Clinic out of San Francisco. I think one of the things, just re-listening to this interview as I'm preparing it now, that kind of struck me too, that I didn't mention in the intro, was the entire idea of how the technology impacts our clients' perception of the services that we deliver and the services they receive. We mentioned it a little bit, how it's very difficult to pick up on micro expressions or nonverbal cues and other subtle emotional and really human characteristics that our patients might be exhibiting that's difficult for us to pick up over a screen, right? And we even talked about how some of that, the latency effect, and how maybe you've got a platform or an internet connection that's spotty and you have the client or your internet service is causing the session to skip or to freeze, and how that can impact a client's perception of not only the quality of the healthcare services that they're receiving, but your competence as a clinician. I was reading an article, I think I mentioned it in the interview, it was published by HP, but it aimed to study what happened to the perceptions of individuals who were receiving communication over telehealth when the latency increased. So when there was, some more drag, or maybe it froze a little bit, or there was a little bit of a delay. And what is interesting is that the folks that were on the receiving end of communication, when the latency increased, and they were using things that I'm not prepared to talk about, like HERS and microseconds and all this kind of stuff. But when the takeaway is that as the latency increased, the individuals receiving the communication began perceiving the communicator, so the person doing the talking, as less attentive and in some cases less intelligent, because of the delayed response. So again, it's something that we need to be concerned about and cognizant of as we set up telehealth systems and methods for delivering care virtually to clients, is that as much as we may or may not want to admit it, technology glitches can really negatively impact our clients' perception of the quality of the services they're receiving and even our skills as a clinician. So that was one of the bigger takeaways that's just now hitting me. So anyways, I hope you enjoyed this interview. I hope you pulled some nuggets away from it. We'll see you in 2 weeks. Until then, be healthy, be safe. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabuppracticesolutions.com. We'll catch you on the next episode.